Assalamualaikum and salam sejahtera. So the topic here is infertility. So we're going to have an introduction to infertility and what is the risk factor, what are the treatment options. So these are the learning outcomes. So at least you should know what is the definition of infertility, what are the causes and risk factors, the goal of therapy for infertility, and some of the treatment modalities. Infertility means that a woman is unable to conceive or get pregnant after 12 months of unprotected intercourse. So it means that that woman is not using any contraception and having an unprotected intercourse for 12 months, but she's unable to conceive. Okay, so there are two types of infertility, which is primary and secondary. It's simple. Primary is when the woman has never conceived before, whereas in secondary infertility, the woman has conceived before. Okay, whether it end up in a born child or miscarriage, as long as she has conceived before, so it's called secondary infertility. So this is just the statistics about the fertility rate of women in Malaysia. So this is a bit outdated. In 2016, the fertility rate in Malaysia is 1.9 babies, and I think recently it also decreasing into 1.7 or 1.8. So it means that the total fertility rate in Malaysia is below the replacement level, which is 2.1. So replacement level means the number of babies need to be born in order to replace the died person. Possible causes of infertility, it can be that woman is not ovulating, we call it anovulation, or the person having oligo-ovulation, which is irregular ovulation. So that makes 30 to 40% of infertility cases, and this can occur due to other underlying diseases or underlying pathological disorders. For example, hyperprolactinemia or thyroid dysfunction. So it is related to the other disorders related to the hormone production. And second is structural abnormalities of the reproductive organ, which constitute of 35% of the cases. For example, fallopian tube abnormalities, endometriosis, uterine polyps, or PCOS. Or PCOS is polycystic ovarian syndromes, meaning that the woman have a lot of cysts in the ovary, and also pelvic inflammatory disease. Other causes are for male infertility. Male have an impaired sperm production or impaired sperm function, and also when the male partner is obese. And also 20 to 30% are actually with unknown reason, and also cervical barrier is 10%. Risk factors of infertility including advancing maternal age. Okay, for example, women who are more than 40 years old, maybe she's not that fertile as compared to younger women. Lifestyle, tobacco use, smoking, alcohol use also might impact the fertility of the woman and also the sperm production for the man. Obesity or underweight might also impair the hormone balance and might leads to infertility. Stress as well, primary or secondary hypogonadism, poor diet, occupational exposure to pesticide, and also medical conditions. So how can we assess whether the woman is actually ovulating? So these are the two tests that can determine ovulation of that woman, because in order to get pregnant, the woman needs to ovulate. Okay, so the first is basal body temperature, which is the how do you call it? We identify the time when the woman is ovulating using the charting of body temperature. The second is ovulation prediction kit. So this is using the urine test in which we can detect the hormones inside the urine that indicates an ovulation occurs. So for the basal body temperature, so the woman needs to take the body temperature every day, starting the first day of menstrual period. And if ovulation occurs, which is normally within 14 days after the first day of period, so they need to do the temperature charting, and the woman will be most fertile during the 2 to 3 days before the temperature rises. So if ovulation occurs, so the temperature will rise. So ovulation actually occurs at the first day when the temperature started to rise. So if they do this charting, then they know approximately when they ovulate, so that they can plan for an intercourse during that day. So for the ovulation prediction kit, it's not using any temperature, but it uses urine. So it's like a pregnancy test kit. It also uses urine, so the woman can check for the luteinizing hormone in the urine, so LH hormone. So LH will surge occurs few days before ovulation. So if the result is positive, the woman is most likely to become fertile over the next 3 days, so they can plan for an intercourse. So other tests is the blood test for detection of thyroid function, if there is any dysfunction in thyroid hormone or hyperprolactinemia, so they need to do some blood tests. For men, they can do a physical examination and also semen analysis. So the goal of therapy is to achieve pregnancy, of course. Everyone who have infertility problem, if they come to seek help, of course they want to get pregnant, but we also want a birth with a healthy infant while minimizing the stress, the physical discomfort, any financial costs or risks associated with infertility treatment. So the choice of treatment, it depends on several factors. For example, the first is the age of female partner, because it correlates with the number of oocytes remaining, so it might have a lower chance of success with women of increasing age. Second is duration of infertility. For example, for young couple less than 2 years, we might not want them to be put on ovulation induction therapy, because we want as much as possible, we want them to conceive in a normal way. So we might want to suggest the temperature charting first and check for the ovulation period first, and try in a normal way. The third is contributing factors to infertility, obesity, if they have a lifestyle, if they have any concerns in the lifestyle, or any use of any medication that might compromise the treatment. The fourth is the risk of treatment itself to the woman. And last one is the cost effectiveness of the therapy, because some of the methods for infertility treatment is actually quite costly. So we have two main treatment modalities. First is ovulation induction, and the second is control ovarian stimulation. Okay, for ovulation induction, we want to develop a single dominant follicle for that woman. So we want them to ovulate. So we will induce the ovulation in that woman. It can be used in patients who are not ovulating or fail to become pregnant after 6 to 12 months of using BPT or PK for planned intercourse. So we will explain this later. Second is it can be followed by time intercourse, intrauterine insemination, or IVF. So it can be used together with other methods as well, so not just ovulation induction. The second modalities is control ovarian stimulation. It's for women who already have ovulatory cycle but still experiencing infertility. So for the first treatment modality, which is ovulation induction, the main drug is clomiphene citrate. So these are the indication. Of course, it's for women who are not ovulating, but also for women who have irregularities in ovulation. The mechanism of action, it induces ovarian follicular development through stimulating the release of GnRH. So you can read further on the details of mechanism of action. So it can be successful in 80% of the patient. So these are the regime of clomiphene. So we start with 50 milligram per day for 5 days. And then we check, the patient needs to check whether she's ovulating or not. So how to check? So it's using the BBT or the OPK. So they need to see the basal body temperature, or they use the urine test of OPK to see whether they are ovulating or not. If yes, then they can continue with the same dose of clomiphene for 3 to 6 cycles more. Okay, if until they become pregnant. If they're not ovulating, then the dose is not enough for them, so they need to increase the dose by 50%, which is 50 milligram. So they can increase the dose to 100 milligram per day for the second cycle for 5 days, and then check again whether they are ovulating. If yes, then they need to continue with the 100 milligram dose up to 6 cycle. And however, if they are not ovulating still, so they need to increase by 50 milligram, which is 150 milligram now per day for 5 days. And then they need to check for the ovulation. If they are ovulating, they can continue for the next 6 up to maximum of 6 cycles. Starting the number of cycles starting from the first 50 milligram dose. Okay. And if they're not ovulating after the maximum of 6 cycle of clomiphene, then they need to consider alternative treatment. So monitoring of the clomiphene side effects, you have to read about the vasomotor symptoms, headache, irritability, mood swing, or nausea. And also one of the main issue with clomiphene is that it will increase the risk of multiple gestation in 8 to 10% of the cases, which means that the woman might have a twin pregnancy or triplet pregnancy or quadruplet pregnancy, okay, because of clomiphene therapy. So we go to the second treatment modalities, which is the control ovarian stimulation, right? So this is when the ovulation induction is not successful, so we have to combine clomiphene with intrauterine insemination. So intrauterine insemination means that we introduce a semen sample directly into the uterus via a catheter placed through the cervix. So the procedure is timed with ovulation to maximize sperm exposure for fertilization. So this is when the patients need to undergo a procedure, so not only the drug treatment. And other treatment modalities, aromatase inhibitors, for example, letrozole, anastrozole. Yeah, you can read about the mechanism of action. It also increases the release of GnRH, but it is not yet approved by the FDA for ovulation induction. Sorry. And the second line treatment for the woman with ovulation disorders, surgery or combined treatment of clomiphene citrate and metformin or gonadotropins. And these are the other treatment. For example, the gonadotropin therapy. So it is a daily injection of not more than 12 days. It will stimulate follicular development. Disadvantage is it is expensive. And you can also read about the side effects here as well. And the gonadotropin therapy, it consists of HCG or HMG. Okay, so you can read a bit about this. And this is when infertility occurs in association with PCOS. As I mentioned before, PCOS is polycystic ovarian syndrome. It affects how the woman ovaries work, and the woman has ovaries that are enlarged, and it has many follicles, okay, inside the eggs. It causes them to have irregular periods, and it can also be associated with increase in androgen, okay, so causing physical signs such as excessive facial or body hair. So there are some percentage of women who have PCOS, and some of them are may become infertile because of this PCOS condition. So to help ovulation in PCOS patients, they can either be given metformin or letrozole, or a combination of clomiphene plus metformin. So these are the other treatment modalities, which is the assisted reproductive therapy. So this is um, related to procedures, not so much on the medication. So you can read on your own how each of these procedures can be done to help patients with infertility. So it includes sperm injection, assisted hatching, and we cryopreserve the embryo, in vitro fertilization, and embryo transfer. Okay, so um, these are the example you can read on your own. Intracytoplasmic sperm injection, assisted hatching. So GIF is also so this is when the sperm and egg are placed into a fallopian tube, and then they put them back into the fallopian tube. So this is IVF. Okay, you can read on your own how it's done. So these are the references that I use for this topic, but of course you can look for your own. And I hope it's clear. If you have anything or any question, just let me know. Okay, thank you.